Hi, my name is Molly Bowman, and today I'm presenting my 5-minute lecture on gastroesophageal reflux disease, or GERD. So what is GERD? Gastroesophageal reflux is the backflow of GI contents into the esophagus, and this usually occurs when the lower esophageal sphincter, or the LES tone, is decreased. GERD is usually referred to as heartburn, indigestion, or acid reflux. So are you at risk for GERD? Multiple risk factors are present for GERD, and factors that reduce LES tone include alcohol, nicotine, obesity, medications such as anticholinergics and calcium channel blockers, and spicy foods. Additional risk factors are age, delay in gastric emptying, and an increase in gastric acid secretion. So some signs and symptoms of GERD. Patients may come in complaining of chest pain or heartburn, which is the usual cardinal symptom, and this is usually after large meals and at night. Additional signs and symptoms are cough, regurgitation, or a need to constantly clear their throat. Some pertinent questions to ask patients. How often are you having these symptoms and at what time of day? The rationale to this is this chronic? Are the symptoms usually after large meals? Are they at night? Question number 2, how is your lifestyle and diet? The rationale for this is that we know that a sedentary lifestyle, patients who are obese and eating large fatty meals or spicy foods increase their risk for GERD. Question number 3, what treatment options have you tried to alleviate your symptoms? We want to know, have patients tried antacids? Do they work? Are they not enough for their symptoms? Physical exam. So our physical exam is usually normal, and there are no diagnostic tests usually needed. Diagnosis of GERD is usually made by history of symptoms, and that's an 80% sensitivity. Additionally, we may do a rectal exam to test for occult blood, also esophageal pH monitoring, or an endoscopy for patients who are experiencing dysphagia. Some common treatments. So our goal is to rapidly eliminate and reduce symptoms and prevent complications of GERD. First line of treatment is non-pharmacological. We want patients to quit smoking, to start exercising, to lose weight, to avoid large meals, to avoid laying down 3 to 4 hours after a meal, and to also avoid bedtime snacks. If non-pharmacological treatment does not work, we go to pharmacological treatment. Mild to moderate symptoms can be helped with antacids or H2 receptor antagonists. If there's no improvement, then we switch to PPIs, and PPIs are an alternative treatment to the H2 receptor antagonist. And we will start with a PPI at a higher dose and reduce until the lowest effective dose. This is ongoing treatment. Patients may use antacids such as Tums for breakthrough symptoms. And our outcomes for this treatment, patients will be free of symptoms and prevent complications from GERD. So here are some examples of PPIs and H2 receptor antagonists. PPIs do promote healing of the esophageal epithelium, and they do work better than the H2 receptor antagonists. Patients who take PPIs for a long time, such as a couple of years, may be at risk for osteopenia or vitamin B12 malabsorption. Some appropriate teaching moments. We want patients to work on their lifestyle modifications. We want patients to quit smoking. They need to lose weight, and they need to sleep with the head of the bed elevated. We also want patients to avoid those trigger foods and drinks, avoid those spicy foods, cut down on alcohol, and avoid late meals. And medication compliance. Reoccurrence of symptoms if medication is stopped abruptly, vitamin B12 malabsorptions, and the risk for osteopenia. Some referrals would be to a gastroenterologist if patients are having vomiting or GI bleeding or are anemic. And we want to reassess these patients in 4 weeks after we start a medication regimen and educate about endoscopy screenings. Some key points: diagnosis of GERD is based on history. PPIs provide rapid relief and healing of that epithelium tissue. And if patients present with alarm symptoms, consider an endoscopy. Always rule out cardiac origin as well. And lifestyle changes are the first line of treatment. And those are my references. Thank you.